The Department of Health just announced a few days ago there's a confirmed case of the mumps in Duval County and 2 probable cases in St. John's. 3 young adults have all come into contact with each other, and so they're trying to limit exposure. Symptoms of the mumps can be similar to cold or flu. It includes fever, headaches, muscle aches, and tiredness. Doctors recommend all children get 2 doses of the MMR vaccine. First dose is recommended at 12 to 15 months. The second dose, 4 to 6 years old. And joining me now to discuss this measles virus is Dr. Bhide from the Mayo Clinic. And we were just talking, this is actually a big deal too, because people who travel, that's part of the reason why. I know the mumps sounds like, what, we still have the mumps? It is still a thing that happens because people travel and bring it back to the United States.
Right. So it's still around and it's very infectious. We think of it as being cured because people can be vaccinated and it can be prevented. But kids can get very sick, especially kids and young adults. We worry especially about young men because they can get swelling of the, we call the parotid glands, which is the salivary glands. And it can lead to very serious complications. Now, some people, of course, will have very mild symptoms. And one of the problems is we don't think about mumps. We don't think about these kind of childhood illnesses that we think are already cured. But I think the take-home message is to prevent this. It's very preventable with a vaccine. So getting the measles, mumps vaccine, getting the first dose at 12 to 15 months, and then again at kindergarten. And then sometimes people will be revaccinated if they need to be in the future.
Absolutely. So the biggest deal is just take your kid to get vaccinated. Yes. And as adults, should they also be vaccinated?
Well, you can check to see if you're immune. If you've had if you've had the 2 doses as a child or a young adult, you should be immune, but I think it's always a good idea to check, especially if you're going to be, for example, if you're going to be around a lot of kids or you're a healthcare worker, if you're immunocompromised, we can actually check to see if you're immune, and if you need another dose, then you can get vaccinated again.
So again, you're saying symptoms could not show up until 14 days.
Right.
So if you come back with this, you may not know, and it's so contagious. I was reading that you can just be in a room, leave the room for 2 hours.
Right.
Somebody come in and get it.
That is measles. So when you can, that's a highly contagious disorder, again, another childhood illness. And you're right that you could be in the room for 2 hours, even after somebody has left the room, and you have probably a 90% chance that you are going to be infected with a viral infection.
And the MMR protects against that as well, though?
Protects against measles, mumps, and rubella. So 3 very serious kinds of infections it can protect.
What would stop somebody from wanting to get vaccinated from this?
Well, I think there's sort of concerns that maybe it's these vaccines are dangerous or they're linked to other disorders. This particular vaccine has really been studied very, very thoroughly. There are studies in the United States, in England, in Denmark. It is a very safe vaccine. It is very effective. But I think that parents are always concerned, and there's a lot of sort of misinformation that's out. But I think we know from our studies that this is a very safe vaccine and it prevents very serious illnesses.
Now, for these cases, we have the 1 in Duval and probably 2 in St. John's. How do you contain it at that point when we know that, hey, somebody's got it?
Well, often
it is so contagious.
Right. Usually the person who has it has to be quarantined, and then all of their contacts or anybody they potentially could have been in contact with will be evaluated, tested. But it can be pretty far-reaching. Most of the people who get, whether it's measles, whether it's mumps, most of the people who get these illnesses are unvaccinated. So we really look for those people who either are undervaccinated or unvaccinated. Pregnant women, another population that we worry about. So before you're getting pregnant, make sure that you're immune, and you can actually check for that immunity.
Because if a newborn gets it,
it can cause very serious birth defects. Yeah.
Well, thank you so much for coming on and informing us. We know that we just gave you a lot of information just now. We're going to post that on our website, news4jax.com. Just look under the morning show section after the show.